Hola, James. I would invite you to start the meeting while we are working to connect Peter Sands, so that we're not too much in delay, and we value everyone's time. Thank you.
Добрый день, уважаемые участники региональной встречи «Нарушая молчание», барьеры, касающиеся прав человека, гендерных факторов, стигмы и дискриминации в сфере противотуберкулезных услуг в регионе ВЕЦа. Сегодняшняя встреча организована Центром политики и исследований в области здравоохранения Центр ПАС Молдова. В рамках осуществления проекта, поддерживаемого Глобальным фондом в Восточной Европе и Центральной Азии, совершенствование, ориентированное на нужды людей качественной противотуберкулезной помощи, от новой модели к улучшению результатов раннего выявления и лечения лекарственно устойчивого туберкулеза TBREP 2.0. Меня зовут Оля Клименко, я глава правления сообщества людей, затронутых туберкулезом TB People Украина. И для меня большая честь, как представителя сообщества, принимать участие в сегодняшней встрече, потому что мы говорим о гендере, мы говорим о правах, и мы говорим о сообществах. А также мы говорим о том, насколько важно выполнить обязательства для того, чтобы сохранять миллионы жизней и придерживаться прав людей. Я с большим уважением и удовольствием представляю сопредседателя сессии борца за права сообщества, эксперта Stop TB Partnership Джеймса Малая. Джеймс.
Thank you so much, Olya. I think it's only appropriate that an event like this starts with the voices of TB-affected communities. So wonderful, Olya, for you to say those opening words. Thank you for inviting me to co-chair this event with you today. And thank you as well to the PAS Center for both organizing this event, but also the work that's gone in to building this really wonderful report with really insightful recommendations, but also the underlying strengthening of the partnerships that have been involved in creating this process. So I just want to start with a few housekeeping issues. Firstly, just so that people are aware, the event will be recorded. Secondly, there's a translation function that you'll see at the bottom of the screen, and you can choose both English, Russian, or if you're comfortable with both languages, you can select neither. Third, for each of the speakers, if you can just bear in mind the translation and slow down your speech accordingly, just to enable our translators the best opportunity to follow. Fourth, there is a Q&A or a question and answer function at the bottom of the screen, and we would invite participants to include their questions over the course of the discussion in using that function, and we'll make sure that we get to those questions over the course of today or through follow-up after the event. And finally, I think we are starting a little bit behind time, but if I can again just remind people to just be mindful of the time allocated, as there's quite a full agenda here today. So I'll try to be quick. Today marks a big milestone in terms of this regional event. It is significant for the countries in the region. It is significant for the EECA region as a whole, but it is also significant globally, as with these CRG assessments in the EECA region, we now have completed 20 TB CRG assessments globally, and that's a remarkable achievement stemming from looking back to the UN high-level meeting just over 2 years ago. All of this work has taken place just in that relatively short period of time. And it's really important as well that this issue of CRG gets this sort of platform and this sort of attention that it deserves, that we know that the TB affected community is calling for this issue to receive. And so I thank all of the panelists for making time today to join this discussion, and all of the participants for also sharing their morning with us today. I hope you all have a warm cup of coffee to sit back and enjoy these robust and important discussions. I note that TB CRG, or Communities, Rights and Gender, so I'll just refer to it as CRG, has grown into a comprehensive approach over the past 2 years. It involves this community rights and gender assessments that we're discussing today, but it also involves other elements as well, including community-led monitoring, advocacy, sensitization around issues of human rights, stigma measurement and reduction, and the participation of people affected by TB in all aspects of the response. And I think all of these themes come through strongly in the assessment, but they are also critical to bear in mind as we think forward around what are the next steps that we hope to undertake. I acknowledge this work that has developed over the past 2 years. From the side of Stop TB, we've been very happy to be involved in this approach, but I want to acknowledge the strong support of the Global Fund and USAID as donors for this, our strong partners at WHO who have worked closely with us in this particular work, and the incredible leadership of all of our community partners at the country level and at the regional level who, like PAS Center and each of the country partners we'll hear from later, have helped take this work forward. Finally, last week on International Human Rights Day, there was the dissemination of the Deadly Divide report, TB Commitments versus TB Realities. And this is a global response from TB affected communities, looking at accountability and looking at the progress made against UN high-level meeting targets and commitments. In this report, one thing was clear and unwavering, and that's that human rights, gender, stigma and discrimination must all be at the heart of an effective TB response. And it's wonderful that we can talk a little bit more to that here today. So without further ado, I want to hand back to my co-chair, Olia, but in a slightly different capacity. Olia, I invite you to make the first keynote remarks for this event this morning. So over to you, Olia, who is the chairperson of TB People Ukraine.
Спасибо, Джеймс. Хорошо, что сегодня, знаете, виртуальные встречи дают возможность вовлекать большее количество людей, а подходы, когда доступен синхронный перевод, помогают нам вовлекать большее количество участников из разных стран и понимать друг друга, и говорить на одной волне. Как сказал уже Джеймс, на прошлой неделе был выпущен отчет «Смертельный разрыв». Вы знаете, я вспоминаю, лет 5 назад мы отстаивали право на амбулаторное лечение, чтобы хотя бы уйти от тотальной госпитализации, чтобы учиться, да, то есть чтобы перейти на модели, когда мы сохраняем людей, стараемся сохранить их в семье, стараемся сохранить их образ жизни. Спустя 5 лет мы говорим о таких вопросах, как уже гендерно ориентированные подходы, подходы, ориентированные на потребности людей. Но говорим ли мы об этом на уровне страны? Как показал отчет «Смертельный разрыв», даже после совещания высокого уровня, отчеты, которые подают правительства стран, если их сравнить с отчетами, как видят динамику представители сообществ, это два разных процесса и два разных видения. И, к сожалению, отчет «Смертельный разрыв» показал, насколько мы еще отстаем со стороны государственных структур в переходе сообщества, и международные организации двигаются намного быстрее в изменении своих подходов, в переходах на новые человекоориентированные потребности. Что же мы должны сделать или что мы можем сделать для того, чтобы все-таки повысить политическую волю, для того, чтобы и государственные структуры были заинтересованы в сохранении жизней. Ведь когда мы говорим о потребностях, ориентированных на человека, мы говорим и о выделении финансирования, и о эффективности этого финансирования. Мы говорим о детях, которые до сих пор госпитализируются без родителей. Мы говорим о тех людях, которые с широкой устойчивостью на сегодняшний день находятся на паллиативе, и, к сожалению, мы не можем им помочь, несмотря на то, что за последние 10 лет было выпущено 3 новых препарата. То есть те подходы, которые мы на сегодняшний день до сих пор применяем в лечении туберкулеза, показывают, насколько мы все-таки еще далеки от подходов, ориентированных на людей. Ведь люди продолжают умирать от туберкулеза. Значит, где-то мы что-то делаем неправильно. И такие встречи, региональные встречи, когда мы можем обсудить достижения, не только достижения, а и вызовы, с которыми мы сталкиваемся, а и сложности, с которыми мы сталкиваемся, являются являются ключевыми факторами для взаимодействия, объединения усилий, построения тех планов, когда мы можем двигаться синхронно в диалоге с нашими правительствами. Тем не менее, я, как представитель сообщества, думаю, что нам нужно говорить не только о достижениях, которые происходят со стороны сообщества международных организаций. Мы все-таки должны искать пути решения, как мы можем влиять на государственные структуры, что мы можем сделать вместе для того, чтобы и в странах менялась ситуация, потому что хочется, чтобы после всех встреч, всех приложенных усилий, ведь действительно колоссальные усилия, колоссальная энергия тратится на то, чтобы была динамика изменений. И нет на сегодняшний день, к сожалению, механизма влияния на правительство. И я думаю, что это наш главный проигрыш в борьбе за жизнь. И как бывший пациент, я горжусь теми достижениями, которые есть на сегодняшний день в странах, в той динамике. Но как человек, который представляет интересы сообщества и на сегодняшний день видит, с какими барьерами до сих пор сталкиваются люди с туберкулезом, с какой дискриминацией, стигматизацией сталкиваются люди с туберкулезом, я все-таки желаю нам более сильного диалога с государственными структурами. Надеюсь, что результаты сегодняшней встречи также станут еще одной ступенькой на пути к преодолению вот этого барьера отсутствия политической воли, недостаточной политической воли. Лилиана, Джеймс, скажите, можем ли мы включать Питера?
Да, Ольга, пожалуйста, Питер Сенс к нам присоединился, поэтому давайте продолжим по программе. Спасибо большое.
Джеймс, тогда я передаю тебе слово. Пожалуйста, представь нашего спикера.
Thank you so much, Olia, for the important reminder of why evidence in community rights agenda is critical for building political will and political actions for change. I want to just jump straight on to Peter Sands, the Executive Director of the Global Fund. I understand, Peter, you're joining us by phone, and we appreciate your participation today. Obviously, with the Global Fund has played a critical role in advancing TB, CRG, both through the TB strategic initiative, other strategic initiatives, and through this TB rep for the specific example here today. And it would be great to hear your reflections about why investing in TB CRG is so important for the Global Fund and contributes to help finding the missing people affected by TB. So over to you, Peter.
Can you hear me now, James?
I can hear you, Peter. Go ahead.
Okay, great. Well, to start with, apologies to everybody for the technical difficulties that mean that I'm only attending by phone as opposed to by Zoom. I will be brief given the delays, but I did want to take this opportunity to reinforce the point that from a Global Fund perspective, tackling barriers to human rights and gender equality related barriers to access to health services is an absolutely critical component of the fight against HIV, TB, and malaria. And we are very committed to the specific efforts that are made for TB. As you know, we established an expert working group, including representatives from TB communities, civil society, academics, Stop TB, WHO, and so on, to develop a technical brief on TB, human rights and gender, which outlined 10 key human rights programs. And these are now part of the Global Fund's modular TB framework. And also the Breaking Down Barriers initiative has been supported, which has been supporting 20 countries to work towards comprehensive programs to address human rights related barriers. Of these, 13 have a specific TB focus. And I have seen with my own eyes, having participated in these, that these are an effective tool to establishing a robust baseline and then initiating a multi-stakeholder process to develop national strategic plans for comprehensive responses. And indeed, Kyrgyzstan and Ukraine, two countries part of this regional CRG overview launched today, are part of that initiative. Now, I'm not at all complacent. one initiative, one technical brief, the efforts of many organizations participating are all making progress, but we still have a huge amount to do. The midterm assessments we've been doing around the Breaking Down Barriers initiative have been showing that there has been great progress, but the responses and the progress on TB continues to lag behind that on HIV responses. So actually we've made some changes in the new grant finding cycle to the way matching funds are constructed. Previously, the cross-cutting ones were only available for HIV, and now we're making those available for TB as well. We are looking to step up investment in human rights-related investments in TB. In this current cycle, we saw a significant increase, but only from 0.08% of our grant investments in TB to 1.21%. So still a relatively small percentage, and we have targeted increasing that to 2%. But in some ways, I'm less interested in what the number is than I am in what the progress is, because ultimately what matters is that we have engagement and activation at an individual country level that actually tackles the barriers that are impeding access to health services for those affected by TB. So my fundamental view is that we are seeing progress on this, but we should all still be impatient. We should be impatient to get the good intentions, the plans, the analysis translated into action that makes a difference for the people who still to this day, through criminalization, stigma, discrimination, it's being made more difficult for them to get diagnosed, more difficult or impossible for them to get treated. This is all the more important in the context of COVID-19. I don't need to tell the people on this meeting how COVID-19 has disrupted TB diagnosis and treatment, and in many places exacerbated the human rights and gender-related barriers. We've seen an upsurge of stigma and discrimination in far too many places. So we need to redouble our efforts to combat that, and we need to do it in a way that helps also the COVID response to, in a sense, understand the importance of taking a rights-based perspective. In many, if not most countries in the world, the COVID response has been top-down and very sort of biomedical and centrally driven. And indeed, one of the weaknesses of the COVID response in many countries is that it hasn't thought about issues of human rights or leveraged the power of communities to lead responses to infectious diseases. And I think one of the things that we as the Global Fund community can teach or help the broader COVID response with is this insight that we have learned painfully over many years, is that you can't beat infectious diseases if you don't engage communities effectively and have them lead the response on the things that matter most to them. And also, you can't beat infectious diseases if you don't tackle the underlying inequalities and human rights issues. So I think this is a really timely and important meeting from a sort of clear perspective to accelerate and drive what we collectively are trying to achieve on human rights and gender-related barriers as they affect TB, but more generally to reinforce the whole approach that underpins this meeting and way of working that says, if we are to beat infectious diseases, if we are to protect the most marginalized, the most stigmatized, those who are most vulnerable from infectious diseases, be it TB or HIV or COVID-19, we have to take an approach that translates nice rhetoric around human rights to concrete realities and change on human rights, and also engages and leverages the power of communities to lead and drive responses. Thank you, and once again, my apologies for not being able to attend on Zoom, but thank you for giving me the time to offer a few perspectives. Thank you very much.
Дорогой Питер, благодарю вас за ваше выступление, и как представитель сообщества хочу поблагодарить Глобальный фонд за колоссальную поддержку, которую вы оказываете сообществам, и в том числе в период пандемии COVID. Для Украины в том числе нереальная роль и в поддержке с препаратами. Вы действительно помогаете спасти миллионы жизней. Я надеюсь на продолжение и расширение взаимодействия сообществ не только по туберкулезу, а и других важных ключевых представителей сообществ с Глобальным фондом. Спасибо, что смогли быть с нами. С большим уважением хочу представить нашего следующего спикера, регионального директора Европейского регионального бюро ВОЗ Ханса Клюге. Уважаемый господин Ханс, пожалуйста, выскажите о перспективах взаимодействия, о подотчетности стран, о том, какие меры и влияния были приняты в период пандемии COVID в том числе, и о том, как же мы видим все-таки важность, доказана ли важность, эффективность человекоориентированных подходов и влияет ли, по вашему мнению, соблюдение прав и гендерных особенностей в подходах лечения туберкулеза на эффективность лечения, достижение лучших результатов? Пожалуйста, господин Хан.
I'm really very, very humbled that you invited me to participate here. And as some of you know, I spent 3 days, very productive days in Kiev, in Ukraine. I'm now in Istanbul, on the way to Tbilisi, to Georgia. And as a demonstration of my commitment, I was meeting yesterday also the Deputy Minister of Justice in Ukraine, and I had Karina from my team with me. Karina is based in Moscow, responsible for Health in Prison Project. And we're going to scale up our activities as well there and everywhere else. And you know, I have been working with MSF myself in some tough places, and Tretje tuberculose de colony in Marinsk. So this topic is so close to my heart. Breaking the silence on the barriers to TB services because of stigma and discrimination is really, and I really enjoyed reading the report. So on one hand, we only have 2.3% of the global TB burden in our region. But we also know that we have a big issue with the drug-resistant TB and all related issues. So, when preparing for the intervention here, I came up with 3 points, 3 strategies to maintain progress towards achieving the 2020 milestones of the NTB strategy, where in fact we're the only region which is still on track. So the first one is strong health systems. I think it was mentioned already. Second, accountability through advocacy, and the third one, sustainable multi-sector alliances. So on strong health systems, central to my mandate as the region director is a commitment to leaving no one behind. And this is operationalized in our agenda for health for the next 5 years, which is called European Programme of Work, EPW. But this relies on strong health systems, and it means primary health care. It means the Alma-Ata and Astana Declaration on primary healthcare. And 2 days ago, from Kiev, I was launching with Dr. Tedros and Dr. Alexei Vladimirovich Tsoy from Kazakhstan the operational framework of primary healthcare to implement the Astana Declaration. And as you know, this is very closely aligned with the TB-REP project. TB-REP, I see one of the fathers there also, Viorel. Another father was Nicolas Canto. And we were working also with Masoud. I want to give credit to Masoud Dara. In fact, Masoud, I have asked Masoud to be my special representative to Belarus now, working closely with Dr. Penevich, the new Minister of Health. So you see, even in strategic positions, we have the people now with a lot of experience on the TB and the HIV. The 2019 TB-REP 2.0 multi-country grant supports this work we are talking about on the human rights, gender, stigma, and discrimination. And this brings me to my second point, advocating for the marginalized and the ignored. The protection of human rights and gender-sensitive approaches are at the top of the WHO Europe agenda. We will continue to advocate for efforts to address stigma and discrimination relating to TB, HIV, hepatitis C, and tackle barriers to care, including through what I read in the report, ensuring confidentiality and a voluntary healthcare continuum. And I was mentioning this also during my high-level meetings in Ukraine, will be in Georgia tomorrow and the day after, and every country. But beyond diagnosis and treatment, we advocate for TB care to include psychosocial, nutritional, and socio-economic support. So therefore, we cannot do this without the communities, which leads me to my final point, collaboration and partnership. Central to efforts to reach everyone living with TB, particularly in the COVID times, are the partnerships. I believe in the power of positive partnership. And we are very fortunate to work in close collaboration with all of you, civil society, communities, member states, donor agencies. I see that at the heart of effective, sustainable alliances or combined efforts across the sectors. The issue-based coalition on health and well-being for all at all ages in the 2030 SDG agenda has provided us with a framework to identify key actionable areas beyond the health sector. What resulted in 2018 was the common position signed by UN agencies, civil society organizations, and other stakeholders. And it shares the principles of respecting, protecting, and promoting human rights, gender equity and empowerment, and engaging the whole society and all development partners. Finally, these combined efforts are reducing the burden of TB in our communities. We do see good progress, but sadly, much work left to do. Having seen the impact myself of stigma and discrimination on patients that I treated, I know action at every level is vital. We know what needs to be done, but we need to reignite the commitment to do it, and today is a great opportunity. In the prisons in Siberia, we used to say, Nadezhda umирает последняя. Hope dies the last. And I feel together very optimistic and a lot of hope. Thank you and stay healthy, my friends.
Уважаемый Ханс, я благодарю вас за соблюдение тайминга. Это сейчас очень важно, потому что мы уже перебираем и отстаем от времени. Также я благодарю Европейское бюро ВОЗ за всю работу, которую вы делаете. Я очень надеюсь, что в странах ВЕЦ и в других странах начнутся внедряться МАВ-чек-листы, которые предоставлены ВОЗом. Мы начали с Украины в поддержке с Европейской коалицией. Я надеюсь, что это поможет нам усилить и действительно проанализировать ситуацию в странах и дать точку отсчета, куда двигаться вперед. Благодарю вас за ваше выступление и с удовольствием представляю нашего следующего спикера, исполнительного директора глобального партнерства Stop TB Partnership Летику Диту. Госпожа Летика, пожалуйста, расскажите нам, 2018 год, Генеральная Ассамблея ООН, событие, которого ждали мы все с нетерпением, к которому мы готовились длительный период, и у нас были надежды, определенные ожидания до события, во время события и после события. Расскажите о важнейших достижениях, которые произошли в период после Генеральной Ассамблеи, и что же, к чему нам стремиться дальше. Пожалуйста, госпожа Летика.
Yes, thank you so much. And I am very pleased to be here this morning because I feel like at home and I feel like really with all the friends. We know each other for so long in this battle. And I hope that you all feel the same as me, which is I'm very excited I am at this moment, because for those of us being in this TB war, the war that we have with this disease, to have a moment in which, in a region in which civil society and communities and activism was not kind of the strongest angle. We used to have the delivery of TB services by mainly public health sector, and it used to be very little I think it was to be very little understanding actually of how important the role of civil society, how important is a TB response anchored on human rights, gender, and without any stigma, how important it is to have that. To be at this moment, I think is really refreshing. I heard both Peter and Hans saying it's great. We have a great long way to go, but it's amazing where we are. I am mindful of the time, and I'm also mindful that my colleague Viorel and James are here. So I know there will be a lot of words and wiseness from Stop TB coming forward. To answer to your point, I have two things to say. One is the UNHLM was a great momentum for us in TB, and we have an amazing political declaration. Some of us, including myself, I was rather skeptical on political declaration, saying it's another piece of paper, right? Yeah, it doesn't work. But actually, having a political tool like this that can be brought in front of heads of states and governments, and held them accountable for what they promised is very, very useful. And the declaration the political commitments and targets there are very strong, are very good, are amazing, I would like to say. And I think that asked by you what great things happened, or what are some of the things that happened since 2018 September in these 2 years, I would say that for me, and I said that already 4 or 5 times this week, is a really booming of the efforts on community rights and gender. It's really booming a solidarity of people affected with TB, of communities. It's really booming an ambition, and I would say a strengthening of the spine and looking up as a community that usually was a bit shy, a bit fragmented, in coming together to push forward the agenda. I think it's a huge transformation we have, and we did this all together with the help of WHO, Global Fund, all the partners, all the civil society, all the networks that are happening, including in this region, TB Rep, TBEC, of course, TB People, and so on. So that's one thing. The other thing is this year was amazing because we had an opportunity to capitalize some of the work that happened, and the Deadly Divide report, I think it's an amazing tool, as it is this one. And that's the point that I want to make here is we have these reports that are really looking, and I read this report. I read this report last night till 3 a.m. And I think it finds amazing things, and it gives us amazing ammunition to be able to address the situation with the barriers that are faced by people in this region. We just need to use it, and there is enough ammunition to go even in other sectors. I was looking at the stigma in this region that comes also from the health workers, right? To address that, you need to have in the curricula already for the health workers how to deal with all these diseases and how to address stigma. I just picked that, and because it's a long way to go, in which not necessarily the TB program managers or the ministers of health are able to address alone without the other sectors. So my point was the great effort that happened on the community rights and gender part over these last 2 years, combined with the reports that were launched toward the last part of this year. That's one. But the second is forward-looking. And the second point is forward-looking. We have 2 more years from this declaration and a lot of work to happen. Let's use what we found out to push forward this recommendation and to be implemented. To not give up if there are challenges in front of us. To not make any compromise in what we ask, which is access for everyone to the best tools and to the best knowledge. To not allow the lack of funds, the lack of knowledge to undermine our efforts to really secure for every single person the best that can be offered in the current moment in terms of the TB response. And let's not forget that next year, 2021, we have to come all together, because at the end of the year, in this time, it will be a decision discussed at the UN General Assembly if the new UN high-level meeting on tuberculosis in 2023 will take place or not. And you know, usually with TB, we are not very popular, and sometimes, in spite of all our efforts, we are forgotten. So let's make sure that next year we sustained demand that we will have a UN high-level meeting on TB in 2023, and the decision is to be taken in 2021, and 2022 will be a year of preparation and so on. So thank you very much. I took a lot of time. Thank you, Olia, and thank you, everyone. It's great to see a lot of ladies driving this effort. Sorry, Viorel, James, and Askar, and Hans, but thank you so much, and let's do this. Thank you.
Thank you so much, Lucheka, for being another one of those ladies driving this effort, and for the passion and the energy bringing to the discussions this morning. I want to just hand over to Stella Vivot from the Paz Center. But before Stella, I just wanted to quickly acknowledge, you know, it's been great from the side of Stop TB to work with TB Rep and the Paz Center. So we appreciate that partnership. And just to also acknowledge one of my colleagues, Tandy, who was involved as well in some of the training from the outset there, because I think it's been such a great example of participatory engagement and partnership, and that's sort of led, I think, to some of the really strong outputs that are here. But over to you, Stella, for your reflections.
Thank you, James. I'm honored to welcome you to this event on behalf of the Paz Center team and its civil society implementing partners. It's TB Europe Coalition, TB People, and Global TB Caucus. And we're also humbled to have such a high-level panel for opening this event. 2020 is a year with a target check for the NTB strategy. And I would like you to join me to reflect where we are in this response. First, the good. We are the only region on track to achieve the 2020 targets for incidence and for mortality. For MDR, our progress is slow despite all the tremendous efforts to accelerate. The list of the reasons can get long. We have the many reports and we know them well. We also know behind the scene reasons. Resistance to change, bureaucracy, and various deficiencies outside our immediate reach, to name a few. Now with COVID, we all feel even more overwhelmed and limited in our collective agency. Today, we have invited you to talk about removing barriers for people affected by TB, stigma, gender, legal, geographic, onerous tasks when we need results quick, right now, in the midst of the worst pandemic of our lifetimes. But it's not the first time we have such a challenge. In the Soviet Union, the country I was born, TB was at all times low, and TB system was strong and well-resourced. The hardship of the 90s brought to our region social distress, health system crisis, causing the challenge of MDR-TB. For the past 2 decades, we rebuilt a better TB response, which meant that in addition to bringing better diagnostics and drugs and investing in basics, we have had to work hard to change systems and mindsets. We fought the disease, and sometimes we fought with each other to get to the results we wanted. But we kept on, and if health systems are resilient in EECA region, it is because the people's persistence and determination despite hardship. Today, I feel hope, and I call you to look at the glass half full. Despite hardship, things look much brighter today than 2 decades ago, 1 decade ago, or even 5 years ago. We finally see a revolution in TB. We first lived through a technology revolution in TB. New rapid diagnostics, AI for X-ray, new drugs, digital tools allowed for people to be cured and at home. EECA is very well positioned to access all of these technology advancements. Second, we are reimagining the TB model of care. The EECA region is literally the first region in the world that when we hear people-centered model of care, we know what this means for TB response. Since 2016, we work to make health services people-centered in 11 countries. We have many more agents of change. We're seeing shifts in mindsets. During TB-REP2, things move even faster for clinical practice as the region embarks on operational research for short-term regimens. And information once available through face-to-face meetings is now more accessible to many more people through clinical consiliums, regional networks in the Zoom era. It is also the time of digital health. We also have a more prominent role of civil society in TB. Once areas of the HIV activism, it is now the TB world, as Lucica rightly mentioned, that has the vibrancy in the region. People with TB have stronger voice and a seat at the table. Our role is more valued, even so, more so in times of COVID. The overview that will be presented today is a first kind of, it's a first of its kind, as I haven't seen similar reports from other regions yet, synthesizing the emerging common barriers at the regional level and providing a solid base to think reactively about next steps. Our role today is to challenge these further and take a fresh look about how to address them. We've been wired to see barriers as walls, not as windows. I ask you today to see them as stairs. And it is going to be us, not anyone else, to do it. It is our generation to end TB, not the next one. We have a decade ahead, enough time to get it done. And I challenge you to meet in December 2030 to celebrate our win in ending TB in EECA region, including through a rights-based approach and ensuring equity. Thank you all, and thank you for everyone on this panel. And I turn over to you, James.
Thank you so much, Stella. I think that was a really, I love the recurring theme of hope here. And I think that galvanizing around this theme of hope and turning it into action at the country level is going to be something that's really, really critical. I think now we've talked a lot about this report, and we've heard Lucica talk about the fact that she's had late nights reading the report, and Hans has read the report. For those of you who might not have, I want to now just turn straight to Nonna to guide us through a little bit about some of the findings that are in the report. So with that, over to you, Nonna.
Thank you, James. Good morning, good afternoon. Hopefully nobody is in a good night time zone, but if you are, I thank you. My name is Nonna, and I would like to acknowledge the team members who contributed to this work. They are Kristina Zharaeva, Samantha Sokolovsky, and Peter Mock.
The title of the regional overview is Breaking the Silence. As people with TB, community members, development partners, or funding institutions, we are already aware of many of the barriers, including those to finding missing people with TB. Several countries have started to pilot interventions to address these barriers, including people-centered care, piloting case management, training primary healthcare workers, engaging civil society in providing community awareness and patient education, symptom screening, and adherence support to key populations they work with. What the regional overview does is pinpoint the persistent problems so we can start finding better solutions and scale up the pilots that have proven to be working so that the interventions reach all of the affected communities. Some of the barriers and the corresponding solutions, which I will cover in my presentation, are related to finding missing people with TB. Others to maintaining people in care and assisting them after treatment completion. The presentation will also highlight the roles of the different stakeholders, including the civil society. A note on what was analyzed and how. From 2016 to 2020, several Communities, Rights and Gender, or CRG, assessments and reviews, including the Global Fund Breaking Down Barriers assessments, were conducted in the region. Last summer, 2020, we conducted and analyzed the available reports and, where applicable, the national TB strategies and the Global Fund funding requests to see if and what CRG recommendations were reflected there. A note again that since the time when the different CRG reports were published, advances certainly have been made in all countries. Nonetheless, scale-up challenges, remaining barriers, and the potential solutions are still applicable to at least some countries of the region. As a result of the analysis, we've identified the most common barriers related to extreme discrimination of some key populations, consequences of TB for women, stigmatization by healthcare workers, people-centered approach, the role of the primary health care, job security and the right to work, and active case finding in rural poor. The assessments show that people who use drugs and people with a history of detention, especially women from these key populations, appear to be the most vulnerable and stigmatized. People who use drugs have difficulty accessing services because of their criminalization, and people with a history of imprisonment encounter barriers when they do not have a national ID or a passport, which often happens following imprisonment. When they do not have a domicile registration, a document often required to access healthcare, some of them are or end up being homeless. For these key populations, an encounter with law enforcement may result in interrupting whatever treatment they are on, which is in direct violation of their rights. To repeat, it is especially women from these key populations who experience higher levels of stigma and discrimination when they meet with the healthcare workers or the police. One of the solutions is improving service integration, and that includes co-locating opioid substitution treatment, HIV and TB services in the lowest threshold setting, and task shifting to CSOs that already work with specific key populations, have access to them, and have their trust. Improving service comprehensiveness can be through the inclusion of peer educators and the work of multidisciplinary teams. For instance, one of the countries proposed multidisciplinary teams visit to prisoners with TB who prepare for release, to include a legal expert who could signpost patients to relevant services. Then we have training for police and prison staff, and a couple of examples are, where possible, including TB-relevant information into already ongoing activities of the HIV program, such as training for the police and the prison staff on tolerance and human rights, and introducing human rights, including right to medical care, into the curriculum of pre-service police training institutions. There are many ways to improve rights awareness of key populations, starting with informing them what services are for free and about the rights and the responsibilities of people with TB. In all countries, the proportion of notified cases is larger in men than in women. Clearly, TB in men needs a gender-responsive approach as part of people-centered care. Across the board, women show better adherence and better treatment results, but these are women who have to overcome larger barriers such as scarce finances, lack of family support, and gender-based violence. In all countries, women carry the burden of unpaid household work and limited childcare options. Their lack of decision-making over finance leads to deprioritizing women's health needs, delaying TB diagnosis, and sometimes delaying TB treatment. Self-stigma is higher in women. In several countries, women spoke of physical, psychological, and economic violence in relation to TB and violations of their reproductive rights. Gender-based violence in TB is rooted in stereotypes, power inequalities, lack of information, and TB myths. Women face such catastrophic consequences of TB as self-stigma, divorce, separation from children, discontinued pregnancies, and multiple issues in case of women-headed households. Some of the recommendations are, first, starting or continuing to disaggregate data. That is, disaggregating all indicators into men, women, and others, including but not limited to drug-resistant TB, TB HIV, and such TB treatment outcomes as mortality or loss to follow-up. This will help monitor programs and design appropriate gender-responsive interventions. In case of TB and pregnancy and breastfeeding, we need to provide counseling on family planning, advice to pregnant women on the risks related to treatment, and help breastfeeding women with TB understand what they should and shouldn't do. We need to take a family approach to supporting people with TB in addressing myths, identifying potential barriers to adherence, and preventing violence. Further, in addressing GBV, we can think of training treatment supporters and multidisciplinary teams in recognizing
and supporting someone who is living with an abusive partner or family member, linking GBV survivors to medical and legal services, and educating the management and the employees of the shelters about TB and how to support GBV survivors with TB. Stigma is often linked to a lack of or breaches of confidentiality and discrimination by healthcare workers. At the same time, many national strategies and funding requests to the Global Fund identify healthcare workers as one of the high-risk populations. There is that increased risk of infection, inflexible compensation schemes, and the lack of legal and labor protection. In high stigma working environments, healthcare workers who become ill with TB prefer to self-treat or otherwise bypass the system because of the negative attitudes from supervisors and colleagues. So addressing stigma and discrimination by healthcare workers needs to start with improving their working conditions, including infection control, developing and implementing strict and clear protocols regarding confidentiality, and where necessary, intervening to change in-house behavior from bullying and stigmatizing to respecting and supporting. This should be coupled with training healthcare workers on key populations, gender, tolerance, human rights, and patients' rights, and including these topics into the curricula of pre-service, postgraduate, and continuous education. Now I would like to discuss issues and solutions related to people-centered approach. Even within any key population, the conditions of people with TB vary and require a corresponding set of interventions. Across the board, the lack of childcare provisions affects women's ability to attend facility-based DOT. Especially during the times of COVID-19, there are difficulties receiving DOT. In some rural and remote places, DOT has not been available at all. So people-centered care interventions, taking into account the individual circumstances, are a way forward. And this includes differentiated case management. This has been recognized by the countries, and pilots are underway, where TB programs can use the vast experience of the HIV programs. There is still a need of more coordinated and inclusive models of care, scale up and tailoring to TB and TB key populations. It is important to integrate case management into the national standard packages of services and make these interventions sustainable. In terms of confidentiality and context investigation, it is important that case managers build rapport with their patients, explaining the importance of contact investigation, underlining the confidentiality of diagnosis, and motivating the people with TB to provide the relevant contacts. There definitely needs to be more than one treatment delivery option, and the countries are already rapidly expanding these, including but not limited to clinic-based DOT, community-based DOT, multi-week dispensing, and video-supported treatment. It is always important to consider the human rights implications of each digitally assisted treatment support option and ensure digital equity so that, for instance, the elderly or the poor are not at a disadvantage. And then there is counseling and addressing self-stigma. This means making psychological care and mental health support available for patients at all stages of diagnosis and treatment, including online counseling for people whose ability to come to the healthcare provider is limited, and engaging CSOs to train and deploy peer educators and treatment supporters. Healthcare workers from the primary healthcare are playing an ever-increasing role in TB response. However, the reports also mention stigma, which may be related to a lack of knowledge of TB and infection control, and the lack of motivation, time, and skills to work with clients from key populations. Solutions, some of which are already being applied to varying degrees across the countries in the region, are providing continuous professional development to ensure PHC staff can recognize TB and are up to date regarding the rapidly changing guidelines, diagnostic possibilities, treatment regimens, side effects, and infection control measures. Depending on the organization of TB care, primary health care may be well positioned to be case managers or MDT members supported by community organizations. We do need to remember that such engagement requires careful selection and additional training, especially to be able to assist people from key populations. It is also important to promote better dialogue between PHC and social services in order to improve the access of people with TB to the state-guaranteed social support, and thus also relieve some of the pressures on the health sector. People with TB often feel insecure about their labor rights. They either have lost work. If employed, they do not know if they can continue working after returning from sick leave. Often they are uncertain how long their sick leave can last and if in practice it will be paid or unpaid. Chances to hold employers, especially in the private sector, accountable are small. Legislation does not always provide the full protection of labor rights during TB treatment. There may be restrictions and inconsistencies in laws or the way they are implemented in practice. Altogether, it makes it more difficult for people with TB to remain in employment and find work once they are cured. Longer absences due to drug-resistant TB treatment mean that at a certain point, drug-resistant TB patients may need to apply for a temporary disability to receive subsistence. Financial insecurity as a result of losing employment triggers treatment interruptions. Measures proposed to improve the protection of labor rights include revising legislation that limits work rights of people with TB who are undergoing effective treatment and cannot infect others, as was done, for example, in Kazakhstan. Adjusting legislation to guarantee preservation of work for the entire duration of TB treatment. Getting rid of laws that impose work restrictions for people who had TB in the past and have been cured. Making treatment support system more flexible, as was already mentioned, under people-centered approaches. Making people with TB aware and providing free legal assistance in case of labor discrimination, as well as other rights violations. Evidence shows that much of the catastrophic costs are not medical and keep occurring post-treatment. Rehabilitation, social, and reintegration services can be especially valuable. Depending on the context, they can include assistance with professional training or retraining, or help with finding employment for people cured of TB. People living in rural areas delay diagnosis because of the remoteness, lack of funds for transportation, and lower awareness about TB. There are challenges organizing DOT, and patients may not receive treatment support. Rural poor more often have to make out-of-pocket payments. Rural population is a very large group and merits a strategy of its own. Some of the elements could be better information and combating stigma, which can be strong in a tight rural community. Gender-responsive interventions, including prevention of gender-based violence. Possibly using mobile outreach clinics while linking and integrating mobile outreach with the existing community facilities and structures to provide such services as treatment support and social support. It is important to identify and utilize the existing actors in the local rural communities and support their engagement in TB response through community systems strengthening. To be able to implement the proposed solutions, we need to increase productive collaboration between multiple stakeholders, including civil society organizations, especially those that already work with key populations affected by TB. A good starting point is engaging CSOs and communities in formulating national TB response strategies and plans. Here, they can provide their insights based on their experience and ensure the programming is rights-based and gender-responsive. Subsequently, to be able to follow and help implement the strategy, non-governmental actors need to be trained accordingly, for instance, in case management, multidisciplinary approaches, effectively addressing human rights and stigma. They need to be included in supportive supervision by the national TB programs to ensure quality of services and the two-way knowledge sharing. As the mandates of the civil society actors go way beyond TB service provision, they need to take a leading role in community monitoring and rights advocacy. And any such watchdog function needs to be backed by appropriate funding. And of course, the two roles, that of a service provider and that of a monitor, need to be separate to avoid a conflict of interests. It is a good practice already used in the region to include civil society representatives in external reviews and other national program monitoring and evaluation exercises. An important observation made by one of the Breaking Down Barriers midterm assessments was that the capacity of CSOs sometimes quickly becomes stretched and needs to keep expanding to match the pace of the CRG interventions. This was the last slide of the presentation. It was my pleasure to give you a summary of the regional report. I hope it sparked your interest and you will share it and use it to assist your decision making. Thank you for being patient with me and thank you for your attention.
Благодарю, Нона. Уважаемые участники, мы немного отстаем по времени, поэтому сейчас, перед тем, как мы продолжим презентации по странам, как вы видели, презентация была на английском языке, но в Дарброксе будет доступны презентации на английском и на русских языках для всех участников, и вы сможете с ними ознакомиться дополнительно. Сейчас мы немножко изменим ход нашей программы, и я хочу передать слово Оскару Дильбаеву, руководителю отдела по туберкулезу совместной программы по борьбе с туберкулезом, ВИЧ и вирусными гепатитами Европейского бюро ВОЗ. Прошу вас, господин Оскар, поделитесь своими идеями о том, как мы можем использовать данные, полученные со стран, которые мы получаем, как мы можем их объединять в стратегические планы. И если у вас позволяет время, пожалуйста, останьтесь с нами для того, чтобы услышать презентации других участников из еще 3 стран. Пожалуйста, господин Оскар.
Dear colleagues, thank you very much. I'm really honored to be here with you today for the virtual launch of this important and highly relevant report on behalf of our TB team at the WHO Regional Office for Europe. And special thanks to the PASS Center for its leadership in organizing this important event. As it has been said earlier today by our regional director, Dr. Hans Kluge, the protection of human rights and gender-sensitive approaches are the top of the WHO Euro's agenda. And we continue to advocate for efforts to address stigma and discrimination related to tuberculosis and tackle barriers to prevention, diagnosis, and care with full respect to human rights and equality. I want to stress out that findings of this important work, of this important report, delivered an important message to everyone, including us at the WHO Euro and in the organization itself, that still there is inequity in accessing to quality diagnosis, treatment, and care. And there are many factors associated with social disparities, many of which affect every single step of tuberculosis pathway. Those people who are at high risk for tuberculosis and those underserved who are oftentimes left behind, like migrants, prisoners, people who live in poverty, most of whom are often in desperate need for quality care, are often forgotten and left in oblivion. Their life is associated with hardships, with constant fight for survival, with other priorities other than their own health, stigma, and discrimination. And this year has been special for all of us. It wasn't easy. It was difficult, and many people's health has been affected. Many people lost their financial stability and source of income. Many lost their loved ones. For tuberculosis, it has been very difficult as well. Tuberculosis detection dropped in many countries of our region more than 50% in comparison with the same period in 2019. Number of people started treatment, including those with drug-resistant tuberculosis, consecutively dropped also, which means that we might face serious rise in the number of tuberculosis deaths in upcoming time. However, this year commemorates the release of 3 modules of the tuberculosis consolidated guidelines, which is the new way of thinking and looking at the tuberculosis prevention, diagnosis, and treatment of drug-resistant tuberculosis. And as you might have heard, last week on the 7th of December, the WHO released the rapid communication on systematic screening for tuberculosis disease. The updated guidance will avail the latest evidence and available best practices on, amongst others, new approaches to screening of people at risk, the role of new technologies such as digital technologies to interpret chest radiography, and the use of WHO recommended rapid molecular diagnosis for screening. Systematic screening for tuberculosis is critical to ensure that we can detect tuberculosis early in the people who need it, including those population groups at risk, also identifying people who could benefit for tuberculosis preventive treatment. This is very important, not to leave anyone without the attention, leave no one behind, to reach everyone living with tuberculosis with the care they need. People-centered approach is across all the work that we do in the WHO and in our support with the member states. In treatment of drug-resistant tuberculosis, that was highlighted in the 4th module of the Consolidated Guidelines of Tuberculosis, there are major significant changes, including the direct trajectory towards making the therapy fully oral, more effective, shorter, and better tolerated. With the new tuberculosis drugs that are available right now in many countries of our region for treatment of drug-resistant tuberculosis, we're able to shorten the treatment regimen with and make the retention and treatment much easier. That will also contribute to the decrease of the stigma and discrimination. In our region, we implement the new initiative that is targeting high-burden countries with tuberculosis and multi-drug-resistant tuberculosis. And this is focused on including introducing the modified, fully oral, shorter treatment regimens for multi-drug-resistant TB, which will ultimately improve the treatment success rate and contribute to the generation of evidence for the future WHO recommendation to make the treatment more safe, effective, and shorter and shorter. So the third point I wanted to say that we are living in the 21st century. We have the digital technologies and digital health solutions. With that, we can use the video observed treatment, of, as we call it in Euro, the video supported treatment. And supported treatment is a broader meaning of the word support. This opportunity will serve as an alternative to the daily mandatory visits to clinic and to substitute that and contribute to the decrease of stigma and discrimination, making treatment more comfortable for patients. And that is also people-centered. Last point, but not least, is the importance of the multi-sectoral response to tuberculosis to address all socioeconomic and other determinants for tuberculosis. The WHO is urging to implement the tool, the MAF-TB tool, to measure the accountability towards achieving the global targets that was initiated during the WHO Ministerial Conference in Moscow in 2018. 17, where all member states were asked to develop the accountability tool. This is important. So during and after the pandemic, we will need to address the structural barriers through the structural and systematic interventions. No data in the world, no good medicine, technology will get to those people in need without you, without all of us, without civil society, without the communities, without affected by the disease. There will be no equity without solidarity. We can make this world better. And thank you for giving me time to highlight these few perspectives.
Thank you so much, Askar, for your remarks. And I know you've got a busy schedule today, so really appreciate you being able to stay with us for today. I think that, like, I just wanted to note there were some really important points there. And just like as you were talking about people-centered care and this being an ongoing discussion and an ongoing journey, and we're continually getting better, that broader CRG agenda is very much in line with that, and a consistent effort to improve and enhance and scale up is something that we all need to be working towards. And in the context of the COVID-19 pandemic, in many ways, it's shone an additional light on a lot of these particular issues, on what it means to be patient-centered, or what are the biggest human rights challenges that we face. And as we proceed to, I suppose, build back better, to try to get the targets back on track at the country level, to reach the targets that we need to get to, there is an ever requiring need to focus on this CRG and people-centered approach now more than ever. So thank you very much for your remarks and joining with us today. And now I'd like to also now come back to our country partners and to hear a little bit around the Georgia experience. So Mariam, I'd like to ask you to reflect a little bit on the Georgia experience around not only the evidence that you found, but what next? How do we take this evidence and turn it into actions? Over to you.
Thank you. Good day, I am Mariam Djibouti, and I will be presenting how the main barriers outlined by the CRG assessment were translated into actions in case of Georgia by community organization New Vector. Next slide, please. Now, first of all, I want to mention the TB journey 7 stages, which is the theoretical frame for which was used for the assessment and the activities. The main focus were those stages, which are recognizing symptoms, seeking care, getting accurate diagnosis, beginning treatment, getting treatment adherence support, completing treatment, and getting post-treatment follow-up services. At the start, a barrier long list was made, which contained all concerns that were outlined by the assessment. So this long list was presented on the multi-stakeholder meeting for the prioritization process, regardless that quite a few barriers were outlined together with the help from the National Center of Tuberculosis and Lung Disease. Those barriers went through a second round of prioritization, leaving 4 main priority areas, which were to be addressed in 2020. Next slide, please. So first priority was to strengthen cooperation between the governmental system and civil society organizations to improve the diagnosis of health conditions and support high-risk TB groups in Georgia to overcome TB journey 7-stage barriers. For this cause, in October 2020, a memorandum of cooperation was signed between the 4 parties, National Center for Tuberculosis and Lung Disease, New Vector, TB People, and Georgian Patients Union. Next slide, please. So a second priority for us was to implement an informational campaign to provide individuals with up-to-date information on where to undergo a major medical examination and how to identify symptoms of the disease. For this purpose, in collaboration with TB Center and Lung Disease, the organization New Vector has prepared informational brochures, which have been gradually posted on our social media. Additionally, the brochures were printed for distribution, and 2 types of brochures were prepared, one addressing the TB journey stages, and the second one addressing TB and COVID-19. Additionally, an infographic video has been developed covering issues of recognizing symptoms, seeking care, locations where the gene expert testing can be received around Georgia, and services delivered under Tuberculosis National Program, and contact information for the National Tuberculosis Center. Next slide, please. As for the third priority, it was the awareness rising for us, and this was taking into account the needs of the community, people who use drugs, LGBTQI community, and people with living with the HIV. So for this purpose, a total of 6 training sessions were held for the TB high-risk groups, led by Maria Janjrova, who is head of the Management, Coordination and Control Services of National National Tuberculosis Center. And once again, topics covered all stages of TB journey. Next slide, please. And for the next slide, please. Sorry. And for the fourth priority, it was advocacy for community-inclusive service delivery, and a roundtable has been planned for December 18 for tomorrow. And the purpose of the meeting is to review issues related to tuberculosis in Georgia. Representatives of National TB Center, Tuberculosis and Lung Disease, New Vector, TB People, and the Georgian Patients Union will be the ones presenting their ongoing activities. In addition, time will be devoted to reviewing TB issues under the transition plan and raising the issues of the one window principle in the context of TB. The second part of the meeting will be dedicated to the discussion of the urgency of the issue and outlining action steps. So information about the meeting was distributed through country coordinating mechanism and the prevention task force, TCM and PDF. And during the meeting, we once again plan to revisit the priority long list and outline the concerns and actions that would be preferable to address during year 2021. So the last slide, this was thank you for your attention, and if any questions and if you need any additional information, you can contact me on my mail or our organization's mail. Thank you.
Thank you so much, Mariam, for your reflections. And I guess wanted to also take an opportunity to note the importance of TB key populations leading these assessments and leading this work at the country level, and to congratulate New Vector on their leadership in this regard. So congratulations and well done. Just a quick note for participants. We are slightly behind time, so we might run over by about 10 minutes or so, or 15 minutes. So just so that you're all aware of this. I now want to move from Georgia to Kazakhstan and invite Oksana Ibragimova, the president of Kazakhstan Union of PLHIV, of people living with HIV, to share her reflections on the Kazakhstan experience. Over to you, Oksana.
Здравствуйте, спасибо большое за возможность представить и результаты, и выводы нашего анализа. И в основном хотелось бы поделиться нашими действиями в настоящее время и те действия, которые будем осуществлять в дальнейшем. Следующий слайд. Я не буду сильно останавливаться на барьерах. Я думаю, Нона достаточно широко рассказала, и, в принципе, все эти барьеры можно будет прочитать в отчете. Если можно дальше, я бы хотела акцентировать внимание на тех действиях, которые мы делаем вот именно по устранению барьеров к услугам по диагностике и лечению туберкулеза, связанные, естественно, с правами, гендером, стигмами, ключевыми группами. Следующий слайд. Мы совместно с научным центром фтизиопульмонологии, со всеми международными структурами, сообществом, неправительственным сектором разработали таких больших 5 направлений. Первое направление, первая задача – это разработка алгоритма кейс-менеджмента с учетом гендерных аспектов. Для чего мы это делаем? Ну, первое – это способствовать вовлечению, и это помощь, это инструмент будет для неправительственных организаций, чтобы все эти моменты, чтобы можно было вести пациента. И основное это то, что, к сожалению, в первичной медико-санитарной помощи чаще наши люди сталкиваются с проблемами. Поэтому этот инструмент, он в принципе нацелен вот именно для медицинских работников и социальных работников первичной медико-санитарной помощи. Сейчас мы его разрабатываем, уже наняты консультанты, сейчас он на этапе обобщения, и я думаю, в дальнейшем это также будет служить тем инструментом, в котором можно будет разработать стандарты и уже потом тарифицировать эту всю помощь для ключевых групп населения и населения в общем. Следующий слайд. Второе направление – это способствовать выделению местными исполнительными органами финансовых средств в рамках государственного социального заказа. В нашей стране достаточно передовая страна, когда наши государственный социальный заказ, мы уже 15 лет Казахстан уже закон был о социальном государственном заказе, уже исполнил. Есть, конечно, проблемы, и наша задача приоритизировать вот именно проблему туберкулеза и ВИЧ. Мы стараемся разговаривать с различными министерствами, чтобы приоритизировать эти проблемы. Ну и также акцент делается на неправительственный сектор, чтобы они понимали, чтобы они могли сделать лот, чтобы они могли с местными исполнительными органами сотрудничать и также реализовывать для помощи ключевых групп вот именно за деньги государственных источников. Следующий слайд. Создание междисциплинарной рабочей группы по ТБ и ВИЧ. Ну, она у нас уже есть, и сейчас мы акцент делаем все-таки для неправительственных организаций, которые работают в регионе, чтобы они включались и чтобы они входили во все комитеты, общественные советы, где именно есть возможность вот именно значимого участия сообщества и приоритизировать, опять же, вопросы по туберкулезу и по ВИЧ. И в этом направлении мы работаем, учим вести неправительственный сектор диалог с людьми, принимающими решения. И также на информационную кампанию по снижению стигмы и дискриминации у нас вот прошло очень, я думаю, широко распространение было социального флешмоба «Болеть не стыдно». Вовлеклись, во-первых, партнерство, стоп-ТВ партнерство в Казахстане, неправительственные секторы, гражданское общество, и это было расширено по всем социальным сетям. Вот именно вопрос, то, что болеть туберкулезом не стыдно, стыдно вот именно не лечиться и вот оставаться где-то беспомощным, потому что помощь действительно оказывается. И если можно, следующий слайд. Это 4-е направление. Это построение диалога со службой первичной медико-санитарной помощью. Пока этот вопрос у нас немножечко вот с ковидом, с карантином остался чуть открытый. Я надеюсь, когда у нас уже будет разработан и согласован алгоритм кейс-менеджмента с учетом гендерных аспектов, мы будем широко этот инструмент распространять и в дальнейшем, надеюсь, даже обучать медицинских работников в поликлиниках, чтобы они были об этом инструменте осведомлены. И следующая наша 5-я задача, следующий слайд. Это сейчас наш любимый, самый важный инструмент, над которым мы работаем. Это создание платформы по мониторингу и соблюдению прав людей с туберкулезом. Это внедрение мобильного предложения ОИНПАК. Оно сейчас проходит, адаптировано уже. Сейчас мы будем переводить на казахский язык. Уже практически все пункты уже залиты в Android и в iOS. И в дальнейшем, я думаю, это будет хорошим инструментом выявления тех барьеров, мониторингами силами сообщества, и, конечно же, планирование уже программ, чтобы они учитывались, все вопросы и прав, и гендерные аспекты. Следующий слайд уже заключительный. Я не буду на нем сильно останавливаться. В принципе, мы в процессе, мы многие вещи сейчас сделаем, и у нас еще есть еще год по финансированию, но я думаю, на этом останавливаться не будем. И я думаю, только с координированными действиями, совместными усилиями мы сможем как-то изменить ситуацию вот именно в Казахстане. У нас, в принципе-то, многие вещи уже делаются, и все хорошо, но есть те моменты, с которыми сталкиваются вот именно ключевые группы населения. И здесь вот по каждому случаю я надеюсь, что вот именно при внедрении мобильного приложения ОИНПАК мы будем уже точные проблемы знать и решать. Спасибо большое.
Thank you so much, Oksana, and thank you for doing that in such a concise way. We're sorry that you had to have less time to present, but it was really important to hear about the Kazakh experience. But I wanted to just note in particular, you talked about one impact and community-led monitoring. And as we proceed to discussions about the actions, about what next, this is such an important part because we now have identified barriers. And the next step, we need to monitor. We need to put in place things to try to address these barriers, to change these barriers, and to monitor these barriers. So thank you very much for sharing your experience, but also for bringing up that very important point as well. Now for the country experience of the Ukraine, and I want to hand back to my co-chair, Olya, to briefly, in just 1 or 2 minutes, share her experiences about the Ukraine experience. Over to you, Olya.
Спасибо, Джеймс. Так, вы запустили мою презентацию сами. Хорошо. Глобальный план по ликвидации можно... Я постаралась на презентации указать всех партнеров, чтобы не перечислять, которые на сегодняшний день на международном уровне, поддерживая сообщество, прикладывают усилия для внедрения ориентированных на СПГ подходов. Поэтому можно следующий слайд, я скажу об этом немного больше. Глобальный план по ликвидации туберкулеза нацелен к изменению парадигмы организации в предоставлении услуг в сфере противодействия туберкулеза путем перехода к активному поиску пациентов, предоставления интегрированных услуг, оптимизации финансовых инвестиций, а также учета прав и гендерно-ориентированных потребностей людей, которые столкнулись с проблемой туберкулеза. Глобальный план определяет около 8 фундаментальных изменений, которые должны быть реализованы в каждой стране, среди которых и изменение способа мышления, не только медиков, а и всего населения, модифицированные и более инклюзивное руководство, соблюдение прав человека, гендерные подходы, подходы, ориентированные на потребности сообщества, и в том числе пациентоориентированные подходы. Такая оценка первая по СПГ прошла в Украине в 2017 году, началась Альянсом общественного здоровья при поддержке Stop TB Partnership. Можно следующий слайд. И целью этого исследования было провести оценку гендерных барьеров, с которыми сталкиваются люди с туберкулезом. Это было впервые в Украине, и это было действительно очень ключевые и важные показатели. После этого, следующий слайд, пожалуйста. В Украине UNDP, снова же при поддержке Stop TB Partnership, провели оценку правовой среды. Целью этого исследования было проанализировать украинское законодательство для того, чтобы выявить барьеры в доступе к услугам по туберкулезу и разработать рекомендации для устранения данных барьеров. Следующий слайд, пожалуйста. И вот в 2018 году, снова же при поддержке Stop TB Partnership, в Украине появляется, было поддержано TB People Украина, в Украине появляется мобильное приложение One Impact, которое через мониторинг на базе сообществ позволило нам проанализировать на практике, да, через общение с пациентами, насколько с 2017 года все исследования, вся адвокация была результативная и эффективная. Ведь последний, кто видит результаты нашей деятельности, это пациент. Если для пациента ничего не меняется, то как бы, да, наши действия, значит, либо не были услышаны, либо не были эффективными. На сегодняшний день у нас более 1000 обращений. Следующий слайд, пожалуйста. И при поддержке проекта TBREP 2.0 и проекта Challenge Facility мы расширили внедрение приложения на всю территорию Украины и видим анализ барьеров, да, то есть мы на сегодняшний день имеем возможность анализировать то, с какими барьерами, на каком этапе сталкиваются люди с туберкулезом, и влиять на это через диалог с представителями власти. Также при поддержке других организаций мы получили возможность оказывать помощь пациентам, что непосредственно помогает сохранить приверженность пациентов. И на сегодняшний день мы предоставляем медицинскую помощь, социальную помощь, психологическую, юридическую и ту помощь, которая действительно ориентирована на запрос пациента. На сегодняшний день результаты внедрения мобильного приложения, в целом анализ, проведенный по СПГ на территории Украины, позволил нам объединить в диалоге представителей Министерства социальной политики, юстиции, образования, Министерства здравоохранения и разговаривать и все медицинские учреждения на местном уровне. В Украине 25 тысяч пациентов с туберкулезом и 25 опорные больницы, в которых люди проходят лечение на стационаре. То есть это очень большое количество охвата людей. И основываясь на доказательной базе, полученной через мобильное приложение, мы на сегодняшний день, используя результаты предыдущих исследований, разрабатываем рассматриваем изменения к законодательству. В Украине был принят из достижений страны то, что был принят 3-летний план реализации стратегии по преодолению туберкулеза, и при поддержке международных организаций и партнеров сообщество в Украине имеет возможность влиять на то, какие предложения, да, какие действия вносятся в национальные планы. И хорошо, что национальная программа все-таки поддерживает изменения и прислушивается к сообществу в Украине. Это последний слайд, да, был в презентации? Сложно, когда не модерируешь. Хорошо, тогда подведу итоги. На сегодняшний день Украина находится на том этапе, как я сказала в своем первом выступлении, когда мы пытаемся провести оценку, внедряя МАВ-чек-лист при поддержке Европейского бюро ВОЗ, Европейской коалиции, национальной программы. Было определено, что Национальный совет Украины будет тем механизмом, который будет вести роль мультисекторального механизма подотчетности. Я надеюсь, что в следующем году, используя результаты национального диалога, результаты обязательства, взятые декларацией, обязательства, взятые резолюцией министерствами, мы сможем вовлечь в преодоление туберкулеза министерства, которые выходят за рамки здравоохранения, и сможем проводить адвокацию с социальной и образовательной сферой. Я очень надеюсь, что эти результаты и перспективы сбудутся, и благодарю всех партнеров за то, что Украина на сегодняшний день такие возможности и достижения. Спасибо, Джейн.
Wonderful, Olia. Thank you for sharing so much information in such a short period of time. It's obviously critical to develop these action plans at country level, and also your points around engaging beyond ministries of health, but other ministries is going to be a critical component going forward for Ukraine, but also something to consider in each of the other countries who are thinking about action items and next steps as well. So with this theme around actions and next steps, I want to turn to hear some further reflections from some of the technical partners and other partners involved. And firstly, I'd love to just hear a little bit from Alexandrina Iovita, who's a technical advisor on human rights and the focal point of CRG in the EECA region in the CRG team of the Global Fund, to hear a little bit about your thoughts around how we can work to further strengthen TB CRG in the region. Over to you, Alexandrina.
Thank you, James. Good morning, everyone. Allow me to start by greeting you on behalf of Kate Thompson, who had really wanted to be here, but regretfully she is not feeling well. So I'm going to be standing in for Kate, and hopefully I'll be able to convey the key messages that she wanted to convey. And first of all, allow us to start by congratulating FAST Center, congratulating the partners in countries on the regional overview, but complements so well the existing evidence base on the human rights and gender-related barriers, on those structural barriers that are conspiring to lead us to miss people with TB, that are conspiring to stop us from the process of ending TB. We're really happy to see that the evidence based on the efforts to address such barriers is also being complemented. And this information, this evidence is going to be really important in the region as well as globally. Such analysis, of course, comes in very handy for strategic purposes, including for the new Global Fund strategy. Our consultations so far on the new strategy cycle have reaffirmed how important human rights, gender equality, health equity, meaningful participation of communities is in the efforts to end the 3 diseases and strengthen health security. So we're hoping that we can further use the TB CRG regional overview to complement that picture. We're also hoping that national strategic plans under development or national strategic plan reviews are going to be able to use this evidence in order to drive action. It's also an important input into the country funding requests, as well as grant implementation strategies under the current grant cycle, in order to ensure that no one is left behind. This overview, the fact that it analyzes common bottlenecks, but also common solutions, can be also extrapolated across the region and maybe also beyond the region, in order to inform evidence-informed actions. We have our Global Fund technical brief on TB, human rights, and gender equality. We have in the TB modular framework concrete programmatic interventions to address human rights and gender-related barriers to TB. This evidence helps us inform such programmatic actions. We will, of course, continue to work together with country and technical partners to ensure that communities and civil society are meaningfully engaged in all the Global Fund-related processes, And we're going to continue to make use of a CRG strategic initiative to enable such meaningful participation of communities. But beyond that engagement, it's really important that we continue to strengthen community systems. We've seen from the country presentations how important the role of advocacy of communities, how important the role of community-led monitoring is, including for accountability purposes. So we're hoping to see more efforts around community system strengthening included in the TB grants in the region and beyond. We'll also continue to work together with you to raise the human rights literacy in TB among communities, among national TB programs, but also among us as partners supporting this effort. We also need to understand how to better factor in the understanding of gender-related barriers, how to enhance gender responsiveness of TB services in Eastern Europe and Central Asia. And we congratulate the regional overview for being able to showcase specific solutions that could work in this regard. We've seen from the example of Ukraine how important it is to have a clear national plan, a clear national action plan with clear activities that are costed, that are budgeted, that clearly outline roles and responsibilities of partners. There are also the midterm assessments that have been produced in the framework of a Global Fund Breaking Down Barriers initiative that can further inform collective work in Kyrgyzstan and Ukraine, taking that evidence from the TB CRG assessments, from the regional overview, as well as the midterm assessments, in order to better guide implementation. We will continue to provide technical assistance in the framework of the Human Rights Strategic Initiative to Kyrgyzstan and Ukraine, but we're also hoping that such lessons learned from the country can again be something that we use at the regional level and we use and mainstream in other efforts in other countries. We're also hoping to continue working together with the Stop TB Partnership and with other partners to develop implementation support guidance, develop more knowledge on what works to address human rights related barriers and gender related barriers to TB services. So we will be using all this evidence that has been presented in the CRG regional overview in order to ensure that the programs that we have in place work, in order to ensure that we are able to end TB together jointly. Thank you.
Thank you so much, Oksana. I think my co-chair, Olya, has just had some connection difficulties she just mentioned to me. So I'll just step in and say thank you so much for the reflections. Thank you so much for the support of the Global Fund and the TB CRG team. It's really important to have such strong allies driving this work inside the Global Fund, supporting the country teams, and appreciate all of your work and partnership there. So thank you so much, Alexandrina. So now moving to Virel Sultan from Stop TB Partnership. Virel, it would be good if you can build a little bit off Alexandrina's comments and maybe to think a little bit around TB CRG action planning and what that is, and if that's something that would be useful in the region, as well as any other opportunities you see in the region to help action the recommendations and findings of this report. Over to you, Virel.
Thank you, James. Thank you, and let me align to those who congratulate PAS Center and TB Rep for great achievement and with the excellent report. This is a unique report, as Stella mentioned, and very important for the region. I would like to congratulate all the partners from the country level. We heard the amazing results and we saw the progress at the country level, and that's impressive. Congratulations all. Of course, WHO as the partner of TB-Rep and the Global Fund that supported TB-Rep in the region. I guess this is a success that is already documented. I would like to congratulate the army of the experts and consultants that supported the efforts as well, Nona, Peter, and others. That's amazing. And of course, my fellow members, team members, Tandy Katolan, James Malar, for contributing this. This is amazing, and we heard a lot of good words around the findings, the recommendations. I guess I have a few points here in terms of like what we have to do next. As Lucica said, this is a great tool, right, to be used. First of all, this is an excellent tool to work at the country level. So those who are in the call today, I guess we have excellent findings and recommendations that should be taken at the country level further. And we need to do a lot of advocacy there. Advocacy from grassroots. It's not sufficient to do a high-level advocacy from top to down. It is important for us to do advocacy at the country level. And of course, all of us, and we heard from Global Fund and others, and WHO, they are all together with Stop TB Partnership are ready to support that. So this is first one. We don't do assessments just to understand the barriers, right? We need to go further, and these findings and recommendations should be included in action plans. We need action plans which are costed very clearly, like a list of actions that should be done in terms of to address these barriers that we see. And this should be costed. And as Alexandrina said, these plans should be transformed basically in projects, and we hear that the donors are ready to support them. These action plans should be part of the national strategic plans. We heard from Peter Sands earlier today that this is very important to that these findings and recommendations are included in the national strategic plans. So a lot to do all together. I mean, I will finish by saying that on behalf of Stop TB Partnership, we definitely here to support all of you at the country level, at the regional level, as well as the global level. I'm proud to announce that we are going to triple the budget for Challenge Facility for Civil Society for next year. So I hope that in January we will announce a next round of Challenge Facility, which is going to be $7.5 million to support all these efforts that I mentioned earlier. So a lot to do for all of us. Good luck. Looking forward to a great work together, and congratulations all with amazing work done. Thank you. Over to you back, James.
Thank you so much, Virel. And I think that, yeah, that is a critical point. Now that we have this fantastic report that the PAS Center and partners have developed, it's critical to really operationalize the findings and the recommendations, to monitor them and to secure the funding and the investment that's needed to really take them forward, and to ensure that the country partners really own these plans and are committed to taking them forward. And I think to echo your points and those of Alexandrina, I think that from the side of some of the partners on the call, we're very ready to help support countries to do that in any way that we can. So thanks, Virel, for those reflections. I think now it seems like moving to our colleague, to Liliana, to share a few reflections from the side of PAS Center around what can we do next? What is the what does TB Rep see as some of the priorities and the next steps? And just before you start, Liliana, just to say a big thank you for all your work driving a lot of the preparation for this webinar and this event this morning. I don't think we would have had such a great turnout and such a robust discussion without all your efforts. So thank you, and over to you, Liliana.
Thank you, James. Good day, colleagues. Здравствуйте, коллеги. I will most probably stick directly to the point, because most of you here with us today are directly involved into the implementation of TB Rep or partnering with us and supporting our efforts at country level. So I will complement what my colleagues mentioned, and Askar started the discussion mentioning a few directions that will continue next year on the TB Rep, and I will only stop on those that have not been voiced before. So a few key streams that will continue in the 2021 and the TB Rep for the countries covered by the project are focused on moving forward and scaling up the CRG stream, basically going there in additional countries with CRG assessment. It's not a secret. We are doing this now with our partners in Armenia, and we will continue with Moldova next year. So we will enrich the evidence we have at regional level to inform the programmatic planning and actions in our countries and region-wide. So in parallel, those countries that have rolled out CRG assessment will have needed support to remove at least partially those barriers that have been identified and work on advocacy to put together a joint, comprehensive costed actions plan, bring to the table all the partners at country level and streamline their efforts. Another stream of work which goes in the same direction, getting evidence to better inform our response, is the analysis we are doing now in a few countries on the patient pathway. Basically looking at how the care-seeking patterns in our people meet the availability of the TB services and how they need to be better streamlined again so that the patient find those services and they're accessible, not only available. The community-led monitoring that has been mentioned a few times today already is another stream of work that will also continue and be scaled up. In addition to 4 countries doing community-led monitoring, their one impact in the region, Kazakhstan is another country embarking into this journey. This is a great opportunity not only to generate feedback, systematic feedback, I will say, from the patient so that the national program knows how to better and quickly reorganize, tailor the service. This is also an opportunity for the teams in country to react on specific needs of the patient and make sure that the people that face issues today get support today so that the treatment outcome do not suffer because of structural or other barriers the people face in their pathway. Linked to that, and also linked to the efforts that the big team of TBREP is doing to advance the people-centered model of care or people-centered approaches in countries, we are together with TBEC and WHO regional office working on finalizing the standardized package of community-based services that will include supporting services and, in addition, costing methodology. So basically, this is a tool that will be available to country to be quickly adapted and used to make their packages of services in tuberculosis comprehensive, involve the civil society and community-based organization in providing those services, but that are not medical by nature and can be easily brought into the model by our community and civil society organizations. In support to that direction, a few other streams are going on. Askar mentioned the video-supported treatment. So a lot of efforts in the region is now, conditioned also by COVID, is put on diversifying the treatment support modalities. And the video-supported treatment is rolled out, is initiated now in 3 countries, and we hope to have a 4th in the upcoming period. And that is in addition to those that are already running different platforms to support people remotely. So in this sense, I believe EECA region is rich and a lot of technology is on the table available and used. Support to health system to strengthen financing mechanisms, to strengthen mechanisms that enable access to quality diagnosis such as ADSM, such as procurement systems, such as RNA. All this is going for the next period, and all this is definitely targeted at improving case finding and at improving treatment outcomes and at institutionalizing those comprehensive, inclusive models of services in tuberculosis that are accessible to everyone, everywhere, no matter gender, appartenance, syndemics for diseases or behaviors. So let's keep this going. And before closing, I would very much like to thank all the TBREP partners, the regional partners. Stella mentioned them in the beginning, and the national partners, because we work with the NTPs at country level, we work with ministries of health, national health insurance companies, ministries of finance. Very much important, we work with civil society, we work with community organization. We have TB people organizations on board. So this is an army that can move stones. And I'm happy to be part of this big team. And I'm sure we keeping this format and these synergies of strengths, we can move the response to the point we wish it to be. Thank you.
Thank you so much, Ileana. Olia, did you want to make some closing remarks? And I note as well, Olia, that I think it's Batma would like to offer some inputs as well. So if you, after your remarks, if you wanted to call on Batma as well.
Добрый день всем. Спасибо за возможность участвовать в этом нашем вебинаре. Очень бы хотелось, чтобы вот это была живая обратная связь, предоставлять слушателям, то есть представителям неправительственных организаций, также поучаствовать, а не только слушать так в одностороннем порядке. У нас потому что есть что сказать. Я вместе по туберкулезу пыталась работать в 2014 году, когда шел такой клич помочь и в нашим неправительственным организациям, гражданскому сектору, который работает в туберкулезе, от более опытных, я имею в виду неправительственных организаций, которые работают в сфере ВИЧ. Мы уже тогда написали, нас поддержала Европейская коалиция по борьбе с туберкулезом, и мы даже написали концепцию по вовлечению и расширению вовлечения, значит, представителей больных ТБ в реализацию, в разработку программ глобального фонда, в разработку проектов по профилактике и лечению, и пытались были вот это расширить, это движение. К сожалению, мы потом не получили поддержки, хотя были и модули разработаны, и исследования проводились по изучению того, каким образом можно усилить вовлечение больных с туберкулезом. Вы же понимаете, что не секрет, что есть ВИЧ-спецсервисные организации, активистов у нас достаточно много по всему центральноазиатскому пространству. По туберкулезу, к сожалению, единицы. Мы не можем похвастать тем, что у нас активисты и те бывшие переболевшие, значит, больные туберкулезом активно в этом участвуют. Почему? Да потому что и есть эта стигма, потому что и есть эта дискриминация, потому что нормативно-правовые документы не работают. И вот хотелось бы, чтобы нам вот здесь, вот мы говорили, да, давайте другие организации в другой сфере помогут им. У нас даже мы создали коалицию по борьбе с туберкулезом и другими социально значимыми заболеваниями. Хотелось бы тоже, чтобы на это обратили внимание. Второе, по новым инновациям, госсоцзаказ. Мы сейчас видим в ВИЧе столько много проблем. Да, это хорошо, конечно, государственный социальный заказ, переход на государственное финансирование, но надо изучать вот эти проблемы. Те, которые мы увидели по ВИЧу, те же самые столкнутся у нас и туберкулезные больные в сфере туберкулеза. Вот эта сфера, которая требует очень достаточно сильного изучения. И третье, это работа непосредственно с ФОМСом. Фонд обязательного медицинского страхования. Где можно найти контрактирование? У нас, например, в Кыргызстане одним, так сказать, словом пытаются отказаться от нас, сказать, что фонд обязательного медицинского страхования только финансирует лечебные программы, только лечебные учреждения. На самом деле мы увидели в уставе ФОМСа, что там и есть раздел общественной программы. В Украине за счет ФОМСа получают и инвестируют, то есть поддерживают программы профилактики в сфере ВИЧ и ТБ. Почему бы нам и в этом направлении работать? То есть у нас огромное количество к вам предложений, и если это будет такая живая дискуссия, это будут живые какие-то наши так сказать, встречи, я думаю, другие даже представители из Казахстана, с Узбекистана могли бы тоже эти предложения для вас озвучить. Спасибо.
Благодарю, Батма, за такое важное выступление. Мы видим вопросы, вы сказали, что относительно обратной связи, все участники, вы можете написать свои комментарии и вопросы в чат, мы их обработаем и ответим вместе с рассылкой информации в Доропрокси. Они будут доступны для всех участников, потому что очень ограниченное время, комментариев видим много, особенно про интегрированные услуги, это действительно очень актуально. Но вы сказали, что одну очень важную вещь, что были активные и очень сильное ВИЧ-сообщество. Действительно, и в Украине, опыт Украины нам стать сильными и влиятельными помогали более сильные эксперты, которые в этой сфере уже более 10 лет и проходили свой опыт по ВИЧ. И менторство – это хорошая практика и важная практика не только внутри страны, но и когда страна помогает экспертизой другой страны. Другой важный момент, который это можно наладить внутри своей страны, который вы сказали, и для этого недостаточно только действий внутри страны, это когда сообщество теряет финансирование. Действительно, мы очень мало стран, в которых правительство поддерживает деятельность организаций и сообществ, потому что как бы ни было, мы все равно остаемся, мы учимся держать баланс, хоть и отстаиваем права пациентов. Это намного сложнее, потому что держать баланс, когда рядом умирают люди, чьи права ты отстаиваешь, это очень большой вызов для представителей сообществ. И тем не менее мы остаемся некой оппозицией. Мы та атомная сила, которая заставляет правительство идти на изменения и что-то делать, да, то есть мы напрягаем наше правительство, поэтому добиться заинтересованности правительства в финансировании организаций крайне сложно, и очень это некая трагедия, когда организация развивается и потом теряет финансирование. Точно такие же процессы проходят и со сменой правительства и министерств, когда 3-летний период, 4-летний период идут наработки, принимаются какие-то решения, потом происходит смена министра, и мы все вынуждены начинать наш круг сначала. Нам всем не хватает устойчивости. И я думаю, что как раз направление создания условий устойчивости – это один из вопросов и приоритетов, над которыми мы все вместе должны подумать, да, как нам все-таки добиться, чтобы не политические изменения, не финансирование не влияло на запущенные, на работающие процессы. Мы закрываем эту сессию. Я благодарю всех участников и спикеров за такие важные доклады и месседжи. Нам есть о чем думать, и нам есть над чем работать. И сейчас мы можем взять немного вопросов для ответов. И я попрошу Джеймс, Виарел, Сайхат и Александрина, да, у нас в сессии по вопросам Лилиана, или мы отвечаем в свободном формате?
У нас в чате я вижу, Михаил поднял руку.
Yes, I can speak. Hello, everyone. Thanks for wonderful presentations. Great discussion. It's not a question per se. It's rather an acknowledgement to the Tajik team, the stellar team of researchers who also completed the research in Tajikistan despite starting late. And there are excellent recommendations, very much coinciding with what we've heard. And the good part of the Tajik report is that all the stakeholders are on board, ready to continue with the implementation. So my acknowledgement to PAS and Tajik researchers, as well as to international researchers who helped them. And a short question, I guess it is relevant to all other reports, is whether or not PAS is going to continue supporting the implementation phase for the reports, for all those recommendations? And if yes, what do you think should be the next steps for all those who took part in the research and for all the stakeholders who are still interested in getting to the implementation stage? Thank you.
Thank you, Mikhail. I will take this question, I suppose. Basically, as I mentioned, we will continue to work with Kazakhstan, Georgia, and we are eager to work with Tajikistan, with CSOs that have rolled out the assessments to remove at least partially those barriers. I'm saying partially because TBREP is a small project, and we shall all together use this opportunity to stress the importance of other partners to get on board. Viorel mentioned a few opportunities, Alexandrina mentioned a few others, and there are other partners. If I'm speaking for case of Tajikistan, there are other partners in country which have the same interests. So I'm sure if we streamline our efforts, we can manage to work on those recommendations that Tajikistan has put into the report. And thank you, Mikhail. Indeed, I've read the report for Tajikistan, a great report with a lot of very practical recommendations ready to be taken on board. They basically do not even need translation. They are actions to be implemented. So I'm looking forward to work with your team and with the team in Tajikistan over the next year to address the limitations that people assessed face.
Я могу, Лилиана, добавить.
Пожалуйста.
Это Сайхат из ВОЗ. Спасибо за очень интересный вопрос. Конечно, отчет очень важен не только в плане того, что имеются как бы findings, да, но и в том, что у него уже имеются рекомендации. И в то время, когда писался отчет в 2020 году, мы, региональный офис ВОЗ, мы уже начали внедрять рекомендации. И мы поддерживаем стран в написании их стратегических документов по туберкулезу, да, и как раз вот эти страны, они начали вот этот этап, новый этап, у них заканчиваются стратегические планы, и они начинают писать новые планы. И я могу сказать, что в нашем регионе мы уже оказали техническую помощь более 5 странам в написании их стратегических планов по туберкулезу, и вопросы, вот как раз те рекомендации, которые имеются в этом отчете, уже нашли свое отражение. Это уже обеспечивает устойчивость внедрения, да, в том числе вопросы как бы оказания помощи со стороны гражданского общества и сообществ, да, вовлечение их в ответные меры по туберкулезу, там социальный контракт, это все есть. И параллельно я хочу сказать, что этот процесс шел параллельно с процессом написания заявок в глобальный фонд. В прошлом году мы оказали техническую помощь 9 странам нашего региона в улучшении качества их заявок. И эти вопросы тоже были включены. И третий механизм, который мы поддерживаем страны, включая Таджикистан, это внедрение механизма межсекторальной подотчетности, о котором сегодня говорили мои коллеги. Это очень важный механизм. И, как вы знаете, ВОЗ внедряет этот механизм, и мы готовы оказывать техническую помощь странам в адаптации и внедрении этого механизма. Это как раз тот механизм, который обеспечивает влияние на государство, о чем говорила Оля в своем вступительном слове, что нет этого механизма. Этот механизм есть, в настоящее время оно пилотируется в нашем регионе в 5 странах, и мы сотрудничаем с ТИБЕК во внедрении этого механизма, и в дальнейшем будем оказывать такую техническую помощь странам, как внедрять это. И я вот, пользуясь моментом, хотела сказать еще одна реплика в вступительное слово Ольга. Вы отметили, что мы должны диалог как бы, да, установить с правительством. Я хочу сказать больше. Вы, вот гражданское общество и сообщество, затронутых туберкулезом, должны двигаться от диалога уже к сотрудничеству, да, и вот этот механизм межсекторальной подотчетности как раз-таки является как механизмом, который объединяет все сектора и плюс всех партнеров, чтобы как бы мы выступили как бы одним голосом и боролись с туберкулезом не друг с другом, а именно с туберкулезом, так скажем. Спасибо.
Спасибо, Саяхат. Мы в Украине действительно уже давно бы хотели перейти к действиям, но, к сожалению, у нас уже 4-й министр меняется за 2 года, и мы живем пока диалогами с каждым новым министром. Я очень надеюсь, что мы все-таки вот благодаря МАВ-чек-листу наконец-то перейдем к действию, потому что уже и план разработан, и гражданский сектор готов, национальная программа готова, пора. Поэтому надеемся на вашу поддержку в том числе.
Спасибо большое, Сайхат. Коллеги, мы можем взять еще 2 вопроса и скомбинировать, может, с закрывающими словами участников панели. Остальные все вопросы получат свой ответ и будут вам высланы в Dropbox. Спасибо. Gender and Development. Спасибо большое.
Здравствуйте все. Я хотела просто не сколько вопросов, а констатировать факты и выразить свою благодарность Глобальному фонду, Центру ПАС, канадской правовой сети, которые оказывали нам неоценимую поддержку в оценке барьеров и в выявлении барьеров, выработке рекомендаций. Конечно, хотелось бы, чтобы все выработанные рекомендации не остались на бумаге и были воплощены в жизнь. Хочу сказать и порадоваться, что те некоторые рекомендации, которые мы разработали, они уже внесены в национальную стратегию. Мы принимали участие также и в разработке новой проектной заявки в глобальный фонд. Вот, и, конечно, сделать акцент о том, что гендерные барьеры есть, гендерная проблематика присутствует в здравоохранении, и необходимо усиливать потенциал неправительственных организаций, которые, к сожалению, ввиду сокращения финансирования немного отдалились от этого, но, тем не менее, проблема туберкулеза, она очень актуальна, важна. И те люди, которые получали и получают лечение, они благодаря охвату общественными организациями все-таки достаточно завершали лечение до конца. Кроме того, хочу сказать, что было бы, конечно, с вашей стороны, если приемлемо, нами разработан план уже активных действий по внедрению вот этих рекомендаций. И если будет, конечно, спасибо и ВИАРЛу, что уверили в том, что будет поддержка гражданского общества. Вот, конечно, чтобы все гражданское общество Таджикистана, которое работает по туберкулезу и ВИЧу, чтобы все были вовлечены. Благодарю вас.
Спасибо большое. У нас еще один вопрос, последний, который мы, к сожалению, сможем сегодня взять. Антон Басенко. Антон, пожалуйста.
Yeah, hello everyone. I'll speak English. Anton Basenko, representative of the community of people who use drugs from Ukraine. So first of all, thanks for this great initiative to raise all these TB issues around communities' rights and gender. I already made some point in chat regarding the opioid substitution therapy. First of all, I would like to echo about what Ola just told, that it's really a huge challenge for us as a civil society, as a communities, when we are pushing something on the political level and we are facing with the fast changing political agenda, people in the cabinet of ministers, in the ministries, and etc. But what I would like to ask, I won't say anything new regarding the need of integration of services for people who use drugs or people who inject drugs and the TB services, because we all understand that for EECA region, people who inject drugs are one of the biggest key population for HIV as well as for TB, I guess. And we all understand that what really works for us as an entry point and the adherence point is a harm reduction programs, including opioid substitution therapy. But if tuberculosis services and treatment is quite familiar issue for the medical staff, for the politicians, and it's quite well understood, and there is no kind of discussions around that we need to treat people or to get them to treatment. But for harm reduction or opioid substitution therapy or generally about the treatment of drug dependence, we know how many myths, how many oppositions and stuff. So my question is, so if as a community, we definitely understand what can be done or what could be done. And in Ukraine, I hope we will definitely have our meeting with TB people as Ukrainian network of people who use drugs to finalize our plan. But what's the plan about? So it's from the bottom to the top. But what about the level from the top to the bottom? What about the plans of Stop TB Partnership, the Global Fund, about the specific focusing or actualization of harm reduction and TB integration? And specifically in OST, we know how lack is the development of OST and harm reduction in the region. We know all this, stigma, discrimination, and pressure. The Kazakhstan, the Belarus, we know all these stories. Specifically in COVID-19, it's all raised. So what are the plans here? How we can synchronize our advocacy in this field? Thanks.
Okay.
So thank you to Anton, to Batma, to Gail, to our colleagues at Gender and Development for their questions, and I think their comments. There's a lot of rich information there and a lot more to be thought about around next steps. And I think Anton in particular, that it's definitely a conversation to pick up with the partners of TB Rep and probably like TB people and networks of people who use drugs to really help take forward a lot of the issues that you raised, because they are important and they do need to be prioritized, and we need to understand best how to operationalize those. With that in mind, I just wanted to sort of look to close what has been a really amazing event. I wanted to thank Nonna, thank Peter Sands, Hans, Luchika, Stella, Mariam, Oksana, Aska, Alexandrina, Virel, Olya, I hope I didn't miss anyone, for your fantastic remarks and during the session and really sharing your insights and perspectives. A quick note on housekeeping before wrapping up as well. There's a Dropbox that will have the presentations in English and in Russian available. Any additional follow-up on questions, answers will be provided, and that will be a coordinated process. And a big thank you, I think, to the PAS Center and the partners of TB Rep for organising this morning, and from my side and from behalf of Stop TB, the opportunity to be involved in what's been a really rich discussion. So just to conclude, I think at the start I mentioned the Deadly Divide report, which was a TB Communities Perspective report looking at progress and priorities to achieve UN high-level meeting targets. It had inputs from over 150 community partners from over 60 countries. And at the heart of it, the call to actions are framed very much by this idea of human rights and social justice. So this achievement of launching this event today shows that the region and the countries involved are taking really important steps in that regard, but that this is a journey and there's more actions and more steps that are critical as part to help take this forward even further. And we know, as I think Anton touched upon, in the context of COVID-19, these issues of human rights and social justice have never been more important, both for the TB response and for TB and COVID responses. So I think as part of this, this conversation, we now have a critical evidence base in the region which highlights the human rights issues, the social justice issues, gender issues, key and vulnerable population issues that require attention. They require nuance, they require multi-sectoral responses, and they require broad levels of commitment at national level and above, because I think that there's different roles that different actors can play to help take that forward. We know that addressing human rights and social justice is not just an ethical imperative, but it makes sense from a public health perspective. Without addressing human rights, without addressing these broader social, legal, cultural, gender-related barriers, we will not end TB. So let's take all of this evidence, all of these fantastic recommendations and turn them into action. And this will form a really critical component on the path to achieving UN high-level meeting targets and to ending TB. And so with that, I'll close. Thank you very much.
Thank you. Thank you. Bye. Have a good day.
Thank you.
Thank you.
Thanks, everyone. We look forward to continue working together. Bye.
Sure. Bye.
Bye-bye.
Have a good day,
everyone.
Take care. Спасибо всем.